Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and exciting show for you this evening. We'll be joined by a panel of medical experts from the field of cardiology to discuss technological advancements in cardiac care. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at cardiac care technology with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Stephen Olenchuk. Dr. Olenchuk serves as Chief of Cardiovascular Surgery for St. Luke's University Health Network and Clinical Associate Professor of Surgery, Temple St. Luke's Medical School. Since assuming the position of Chief of Cardiovascular Surgery in 2008, Dr. Olenchuk has focused his program on innovation and quality. The program has been recognized by the Society of Thoracic Surgeons, a 3-star program for quality, and has received Thomson Reuters' 50 Top Cardiovascular Hospital in the national distinction. His clinical interests include adult cardiac valve therapies, aortic surgery, and heart failure. Dr. Olenchuk's outcomes for valve and other cardiac procedures have remained consistently above the national benchmarks. Thanks for being here, Dr. Olenchuk. What propelled you to focus on cardiology as your career path?
There's something special about taking care of the heart, being able to operate on that and make such a huge impact and change in people's lives. It's really rewarding. And also, too, I think one of the other things that I really liked about cardiac surgery was that when we do different operations, we really pay attention to the outcomes for patients and try to always improve on that. There's such a great amount of research that goes into what we do and the surgeries that we perform and analyzing the outcomes, trying to make it better every single time for patients. And the amount that we put into that's pretty robust. And so I think that's a little bit separate from other operations and other surgeries people may have.
Great information, Dr. Olenchuk. Thank you. Joining our panel next is Dr. Steve Stevens. Dr. Stevens is a board-certified electrophysiologist and fellow of the Heart Rhythm Society. After graduating from the University of Southern California Medical School with honors and finishing first in his class, he completed a residency at UCSF and a fellowship at Cedars-Sinai and UCLA. Dr. Stevens performs advanced procedures to treat rhythm disturbances of the heart, such as ablation for atrial fibrillation and implantation and laser extraction of pacemakers and defibrillators. He also performs the Watchman procedure to reduce the risk of strokes and enjoys the team approach to complex procedures such as this. All right, Dr. Stevens, thanks so much for being here. As a clinical associate professor, why do you find it important to educate the future doctors of tomorrow and share your knowledge and your love of cardiology?
So when I was looking for my first job out of training, which was 7 years ago, I was specifically looking at places that were teaching institutions. One is just kind of enjoyable to teach. I really think you learn the most when people are asking you questions. And I think that if you really want the best care possible, you want to be in a teaching environment because it puts you on your A game. You need to do the right thing to teach it right. And if you're a true master of something, then you should be teaching it. If I do a good job and the people that are learning do even a better job, the impact is exponential because then they're going to help more patients and then they'll teach and then those people help more patients.
Insightful information, thanks, Dr. Stevens. Let's meet our final panelist, Dr. David Allen. Dr. Allen is board certified in nuclear cardiology, cardiovascular medicine, and internal medicine. He also serves as the medical director of the Heart Failure Clinic, which specializes in the treatment and management of patients in various stages of congestive heart failure. The focus is the education of patients and their families to become full participants in their own home care, improve their quality of life, and subsequently reduce the need for repeated, long hospital stays. Dr. Allen implants pacemakers, performs laser lead extractions of pacemaker and defibrillator leads, and specializes in pulmonary hypertension. Welcome, Dr. Allen. Thanks for being here. So tell me a little bit about your position at St. Luke's and what it means for you to be working so diligently on heart failure.
So I was brought in to St. Luke's and hired about a little over 7 years ago to start and run our heart failure program. I started off in private practice in general cardiology and went back and did a fellowship in heart failure because I always felt limited in what we could provide some of our advanced heart failure patients. And I think heart failure and what we're able to provide at St. Luke's is kind of hope for patients who are running out of options on medical therapy, who aren't doing well. We provide that final step to help guide them through. And that field and what we do at St. Luke's is either provide them with continued support. It kind of combines both the technological advances that are happening in cardiology with the longitudinal care of really getting to know your patients and kind of treating them almost like they're your primary care patient.
It is amazing how much getting to know your patient and the hope matters in getting people through what is often a very difficult diagnosis. So thank you so much for that. Thank you all for giving us some background information on your expertise in cardiology. Next, we'll dig deeper and talk about the basics of heart disease. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Compassion, innovation, technology. Trust your heart to one of the nation's 50 top cardiovascular hospitals. My Health, My Hospital.
St. Luke's.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel before the show. Joining me is a talented group of medical professionals, Dr. Olenchuk, Dr. Stevens, and Dr. Allen. We've started to discuss everyone's background and expertise in this field. Now we're going to talk about the basics of heart disease. Dr. Olenchuk, I'm going to start with you. Just the basics. What is heart disease, and what are some common things someone could be diagnosed with that would be considered heart disease? That's kind of a broad topic.
It is. It can be medical, from having abnormal cholesterol labs to more structural type of heart disease. Still, one of the most basic things that we see as far as referrals for patients with heart disease is blocked arteries to the heart. So the heart is actually has to pump the blood to its own heart muscle. And sometimes when that doesn't occur, patients develop angina or chest pain from a decrease in blood flow to the heart muscle. That's still one of the most common things that patients develop when you think of heart disease. They can also have valve problems or major aortic problems or heart failure.
There are so many things that could be going on, and there might be a lot of ways to diagnose that. So, Dr. Allen, I want to ask you, how do you diagnose someone with heart disease? How do you figure out specifically what's going on and how serious it is?
All diagnosis starts with a good history and physical. Taking the time to speak with your patients. There's certain buzzwords we hear through our medical training, certain complaints that we hear that get us concerned on different diagnoses, whether that be shortness of breath or chest pain or palpitations or edema or swelling in your legs. There's different complaints that lead us to different potential diagnoses. And from that, we can work with some of their concerns and some of their complaints and do different diagnostic testing, such as EKGs for arrhythmias, monitors, echocardiograms, which are ultrasounds of the heart to look at the structure and function of your heart, stress testing, and even cardiac catheterization. So we have a lot of modalities that we can help the patient come up with the diagnosis for their concerning symptoms.
And I want to switch over to you, Dr. Stevens, because I know Dr. Allen just mentioned some of the symptoms, but what are things people should be looking for? What is that little red flag inside of you that would say, maybe I am experiencing some sort of heart issue and need to get checked out?
Heart disease, sometimes it could be quite obvious. Like you might picture someone having a heart attack, grabbing their chest and saying, oh, I have chest pain. So certainly chest pain is a sign of heart disease. Sometimes it could be less obvious, like their exercise tolerance has decreased. So I used to be able to run 3 miles and now I get tired at 1 mile and I need to stop, that could be a sign. Or I'm getting short of breath when I do things that I didn't used to get short of breath doing the same thing. There's been a change. Other things could be swelling in the ankles. And certainly that's a sign. Or you seeing those sock lines that people get that are getting really prominent. And then sometimes swelling of the belly and weight gain. That's not fat weight gain, but water weight gain could be related to water backing up from your heart. Just generalized fatigue sometimes can be associated with heart disease. Palpitations, feeling an irregular heartbeat, that certainly could be a sign of heart disease. And then lastly, people that get very dizzy or pass out could be a sign of a heart problem, such as a slow heart rate.
Dr. Olenchuk, when a patient has received a diagnosis of some kind of heart disease, what are the first steps that they make? That can be very scary. How do they know what treatment options they have and who to go see?
Well, usually they're probably going to be referred to a cardiologist who will initially do that workup to try to figure out exactly what is going on with the heart. As Dr. Allen alluded to, there's other testing that may occur. And often still, the one thing to remember is that a lot of this heart disease, when you're made with that diagnosis, can be treated still with medicines and lifestyle changes, whether that's changes to your diet, increasing your exercise, and taking medications can still really help treat a great majority of heart disease. When it does become maybe more serious, often there are definitive treatments. So if a patient has a blocked artery and may need a stent, that can really be pretty definitive for the patient. And yes, you still have other lifestyle changes and medications going forward, but it makes a great improvement quickly.
So there can be a combination of the lifestyle, medications, and treatments. And, Dr. Allen, what are the possible complications of someone having heart disease and leaving it untreated? And how early really can you catch something and make an actual difference through those lifestyle changes or medications to maybe prevent something that's surgical later on?
We always say in the cardiology field that the best treatment is prevention. Living that healthy lifestyle right off the bat can help decrease your chances. And of course, if you delay concerning symptoms such as shortness of breath or chest pain, you may do damage to your heart. Going to see a physician, whether with your primary care first or then with a cardiologist, to address some of your concerning symptoms are important, because at some points we see people very late in the game and they've already done a lot of damage to their heart muscle.
Well, you bring up time, and I want to ask Dr. Stevens, when should a person see their doctor to really start to analyze their heart health? When does that really start for someone?
We should be seeing a primary care doctor once a year. And one of the things they're screening for is your blood pressure, your heart rate, and cholesterol panel, which is done with simple blood work. And those are pretty good screening measures to prevent heart disease. So people with high blood pressure are high risk for heart disease. People with high cholesterol certainly are high risk for heart disease. And then if your heart is abnormally slow or abnormally fast, when they check your vitals or your heart rate, that could be a sign, and they might follow that up with an EKG. I think in your 30s, it's a good idea to be seeing a doctor regularly to get your blood pressure checked and your cholesterol. And certainly by your 40s, you should be doing that at a yearly basis. Things you can do at home is exercise. Everyone should be doing some sort of exercise. If they notice their exercise tolerance is changing and getting a lot worse despite them trying to work out to improve it, there's probably a problem. Like exercise tolerance should stay the same or get better the more you work out, not get worse.
Often, Dr. Olenchuk, when someone realizes that they might have some heart conditions or heart issues, their vascular health comes up. Can you help explain how those two are connected and how you work together with vascular surgeons at St. Luke's for the good and health of your patients?
We have the cardiovascular department, which really focuses on all of these things. Just as I mentioned before, you can have blockages in heart arteries that may also be occurring in other locations throughout the vasculature of your body. So the same type of process that is occurring often in the heart can really be occurring anywhere throughout the vasculature. And so we work very closely with an entire cardiovascular team to make that assessment for the completeness of the patient.
Dr. Allen, when a patient comes to see you and they realize they need to get some sort of intervention, what is your general approach to them, and what do you want them to know about the process of working with you or with any of the cardiac surgeons at St. Luke's?
When people know that they might need intervention, there's apprehension. So I think taking that extra time to educate the patient to describe to them what is going on. We often show them their films, their echoes, their studies, and letting them know that working with our surgical colleagues is part of a full team. We have an integrative approach so that we do some of the earlier testing, and then our surgical colleagues take it forward from that point of what they would need to do and go over the surgery with the patient.
This is such insightful information from all of you, but we're not done yet. After the break, we'll learn more about minimally invasive treatment options for specific types of heart disease. You're watching St. Luke's Health Now. Stay tuned.
St. Luke's knows that trust is the foundation of all relationships. It's earned over time. It's the type of relationship you should have with your healthcare team. While our healthcare needs are different, one thing is constant. St. Luke's is focused on building a lasting relationship with you, earning your trust and putting your well-being first. When it comes to great healthcare, trust is essential. St. Luke's, the care you trust, now more than ever.
Medical emergencies can and do happen during COVID-19.
One American has a heart attack or stroke every 40 seconds.
And one American dies from stroke every 4 minutes.
Heart attacks and strokes will not wait until a pandemic runs its course.
It is not safe to sit home and hope the symptoms pass. It is safe to come to St. Luke's.
Our EMS crews and ambulances
are ready for you, taking every measure to keep you safe.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an intriguing show for you tonight. We've been talking about cardiac care at St. Luke's. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Olenchuk, Dr. Stevens, and Dr. Allen. Thank you all for being here. In the first part of the program, we talked about your backgrounds in this field and the basics of heart disease. Now let's dive into some exciting technological treatment options. Dr. Olenchuk, I'll start with you. Can you tell us about some treatment options that you offer patients that might be having, some sort of valvular heart disease? What are those options and how do they work?
Valvular heart disease has really changed over the past 5 and 10 years. There's new technologies, new advances that's allowed us to take care of patients maybe that were initially too sick for a regular standard operation. Aortic stenosis is an example of a very common valvular heart problem that we see. And that's where the aortic valve becomes very narrowed, it gets calcified, and the leaflets don't open and close as well as they should. And you can't get as much blood flow out of your heart. Over the years, standard operations through the breastbone to take that valve out and replace that valve has become very common. We do that. And in the past, probably 5 to 10 years, we've seen a change from that standard operation through your breastbone to replacing the valve using what's called a catheter valve. It's a valve that is able to be crimped on a balloon. The balloon is then passed through a puncture in your leg up to where your old heart valve is. The balloon is re-expanded, and what that does is it pushes your old valve open and out of the way, and this new cage locks in place. It's all done percutaneously, or rather just through a stab and a small little puncture in your femoral artery or the artery in your leg, and that's how we're able to get the valve there.
When you hear or know someone who's gone through some sort of procedure, a heart procedure, how quickly they recover. I think it's important for patients to understand these various treatment options because they sound scary, and of course it's your heart, so you're nervous, but at the same time, the outcomes are so good and the recovery time is so fast. So how has that been for you to see that change over your time as a physician?
It's absolutely amazing. I mean, we've had great push and great strides to try to improve mobility for patients, even with open surgeries. But now with catheter valves, patients are often able to leave the hospital the next day. They are recovered very quickly. The operation itself may take around an hour to do. What's really amazing too is that they notice that benefit of that new valve going in so much faster now because the recovery is quicker. So they're really seeing the benefit of having a valve that can open and close well. It's unbelievable how many patients right off the bat tell you they can feel better, that they feel better. They already notice it. They can breathe better. It's come a long way. The outcomes with this are just phenomenal.
Really amazing and so great for patients to know, to see that result even in just one day. Dr. Allen, you work with lots of special implants. You work with heart failure patients. Tell us how they work and what the options are if you are a heart failure patient and what kind of implants they can get.
A lot of heart failure is driven by valvular disease. So when people have a low heart function, to have the resource and the ability to do a TAVR or a clip for the mitral valve is really helpful for our heart failure patients. There are other monitoring systems. There's a relatively new monitoring system called CardioMEMS. It's an implantable pulmonary artery pressure catheter measuring system. So really what that means in layman's terms is we can tell if people are fluid overloaded before they even become symptomatic, and we can help adjust their medications or their water pills before they even have to call the office, and we can monitor that from the office. And that really proven to be a significant impact on the management of chronic heart failure patients. We have other kind of devices called cardiac contractility modulators that help improve the squeeze of the heart and improve their functional class and what they're able to do every day. And lastly, we have pumps that we put in the heart. The latest is a pump called the HeartMate 3. That's a surgical procedure where it's implanted in the heart and basically takes the blood out of the left ventricle and delivers it to the aorta. When I came to St. Luke's, we implanted our first gentleman 1 month after I got here, and I still see him in the office over 7 years later. And this is for a gentleman that really had no option and was on his last legs and has done fantastic. So those options that we have for the patients seem to grow almost every year in heart failure. And it's exciting to be able to help the patients by offering them.
It really offers a lot of hope, Dr. Allen, and neat to hear that you've had that same patient 7 years later. You know, you mentioned something. I want to turn to Dr. Stevens because there are heart rhythm issues people may be experiencing. What types of treatment devices are available, Dr. Stevens, for those patients?
So as an electrophysiologist, I'm kind of like a heart electrician. So I do a lot of implantations of devices such as pacemakers and defibrillators, which are internal surgically placed devices that would speed up the heart if it was too slow or shock the heart if it was in a dangerous rhythm. And I do ablations, which is kind of like burning the inside of the heart to rewire electrical areas that are abnormal. One of the newer devices that we implant prevents strokes for atrial fibrillation. This is a form of structural heart surgery where we actually implant a device inside the heart that serves as a cage or blocks up the area of blood flow in the left upper chamber of the heart, and that is the area where blood would clot and form strokes if you had atrial fibrillation, which is an irregular heartbeat. That device is called the Watchman. So that is a preventative measure to prevent strokes in people that have trouble with blood thinners.
Thank you all for sharing these exciting advancements to help heart patients. It really gives a lot of hope. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network.
Staying home but still need to see your doctor? Schedule a virtual visit with your St. Luke's doctor or specialist for all your healthcare needs. Easily access your appointment from your smartphone, tablet, or computer. Your doctor will be able to assess your needs and even send a prescription if necessary, all in one quick session. Call your St. Luke's doctor to schedule your virtual visit today. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about cardiac technology treatments at St. Luke's. Now we're going to read some questions from our viewers. All right, you guys ready? Dr. Olenchuk, I'm going to start with you. This person asks, if I have the TAVR procedure, will my chest be opened up during the surgery?
For replacing a valve using a TAVR, transcatheter aortic valve replacement, it's all done percutaneously through a puncture in the leg. And we actually have modified this over time to just use one side of the leg as needed. And so it does not involve the chest to be opened. It makes for a much faster recovery.
Well, that's always good news for sure. All right, Dr. Allen, I think this is most appropriate for you. Is the CardioMEMS implant something that I'll be able to feel and see under the skin?
It's in the pulmonary artery, so you will not be able to see or feel it. It's actually in the artery. So no, you would not be able to feel it.
All right, Dr. Stevens, this question is for you. This viewer asks, I have AFib and I take a blood thinner medication. Am I a good candidate for the Watchman?
Blood thinners are standard of care for people with atrial fibrillation that have increased risk of stroke, and they prevent strokes, and they're quite effective at that. And I always recommend, if you can take a blood thinner, that's your first choice. But there are people that have trouble with blood thinners. They bleed for a variety of reasons, whether it's they've had a bleed in their brain or bleed in their GI tract or intolerance to the medication for whatever reason. And then they can't take that medication and reap the benefits of stroke prevention. And that's where the Watchman really has its niche, is for people who can't take blood thinners. There's an alternative that also prevents strokes. But I think if you can take the blood thinner, that still is your first choice. It's obviously less invasive and lower risk, and probably more effective than any surgical procedure.
Okay, Dr. Olenchuk, I think this one is for you. Is the Sapien heart valve made with any animal parts? What exactly is in it?
We get this frequently because a lot of people are interested. What is the valve that is being replaced? What's it made of? Historically, everybody has heard, I think, of pig valves, and that used to be the valve, an actual valve from a pig. These Sapien and current transcatheter aortic valve replacements, they're made with cow tissue or bovine pericardium. That's the sac that surrounds the heart in a cow. It's actually cut into strips. It's treated with some anti-calcification material and actually hand sewn at the factory onto a metal cage. A question we get often is, can you reject it? Your body will not reject it because it's not live tissue. But the concern is that sometimes, just as your body is calcified your own valve, it can calcify this cow tissue as well. Thankfully, usually not for many years down the road.
That's really unbelievably fascinating. All right, Dr. Stevens, here's a question for you. If I get the Watchman device, will it need to be replaced at some point? That's a good one. Do you have to go through that a couple times?
Fortunately, it's a one-time procedure for a lifetime. So once it's implanted, that part of the heart that it was implanted actually seals off. It's a chamber called the appendage. And then that chamber will basically no longer exist. The Watchman will become flush with the inside of the heart, and you'll grow heart tissue over the face of the device, and it really becomes part of your heart. Anyone with increased risk of stroke for atrial fibrillation, we use something called the CHA2DS2-VASc score, which is a fancy way of saying we look at risk factors for stroke. So people with blood pressure issues, people who've had prior strokes, diabetes, older patients are increased risk for stroke. We'd like to reserve it for people who have had some type of trouble with the blood thinner. Often people have bleeding issues with blood thinners, and that's when they seek alternatives such as the Watchman.
All right, excellent. And our last question, Dr. Allen, will be for you. Can I travel and take airplanes if I have the CardioMEMS implant device? Can I get up and go?
Yes, there's no travel restrictions. There's really no concerns with that whatsoever.
Thank you all so much for being a part of our panel, and thank you to all of you for watching. For more information on cardiovascular services at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.